Good afternoon and welcome to Nordic Health 4.0 the Amplifiedness. Now we have actually went through two sessions earlier, 3 p.m. we have in chat and 4 p.m. with Alto. If you miss it, not to worry, it's all recorded on the YouTube channel. Just email to me, then I can actually share you the YouTube link. So now following at 5 p.m. we have Ascom who will be sharing their solution. So tomorrow we only have one sessions tomorrow. That will be the last one, 4 p.m. from Otivio. So the presentation structure will be 30 minutes of presentation, including demonstration, and then 15 minutes of Q&A. So presentation has started since the 7th of June, and tomorrow is the last session. So if you want, you can email me. I can actually send you the link for the recorded online sessions. They are all in the YouTube channel. And if in any case you are still facing other challenges which are not covered in this list of presentation, please email to me, then we'll be on the lookout for solutions. My name is Nika from Innovation Norway. Is my mobile number and my email. And a total of 17 companies we sharing their solution in this program. So these are the first 8, and these are the remaining one. So without further ado, let me introduce Vic. Vic will be sharing on behalf of Ascom. So I'll just stop sharing. You can go ahead and share.
Yeah, thank you, Nicker. Let me know once you can see my screen.
Yes, we can see. Yeah, good. Go ahead.
Yeah, thank you for introducing us, Nicker. With much further ado, I will talk about Ascom solution presentation today. How we can help the hospitals in Singapore to address some of their problem statements, so to drive the innovative solution along the journey with Ascom with the hospitals in Singapore. So today's agenda will be just a high-level introduction and talking about healthcare platform, how our platform help for the hospitals or the nursing homes or the community care, by and large, by introducing our solution, which is a proactive care platform, as well as some additional solutions related to alarm and alert notification, which will help us to reduce the alarm fatigue using our centralized dashboard and mobility solution. And also we will touch upon today on the intelligent sensing, especially on the elderly care and the nursing care, as well as for the smart care solutions, which we have as part of the by integrating the sensor or wearable technology. So in conclusion, we will be discussing at the high level why Ascom, what we can bring to the floor for the hospitals in Singapore to work closely with us to achieve smart and innovative solution for the futuristic workflow enhancements. So while taking to the presentation, please stop me wherever and whenever you require to have some clarification on the slides which I am going to present you today. And this will be pure slide-based presentation, and we might not have a demo to culminate here. So, but feel free to stop me during the presentation for asking any questions. So as Ascom healthcare platform, as a vision statement states that we are trying to bring the care communication team for the care coordination by bringing the digital information gaps so that we create actionable insights to enable the easy and proactive clinical decision support for the caregivers within the care settings. So looking at the vision statement, we Ascom have a platform which talks about this particular vision into a reality. And how do we do that? With being 3 pillars, which is connect. That means we connect the different devices or the different systems inside the hospital or community care or the step-down care settings. We connect to those, and we make a relevant decision within our second pillar to send the information to the caregivers, right information by filtering the information which is not critical, and prioritizing the information which is more critical in a definitive form in a near real time. And thirdly, we try to visualize the information to the caregiver by a dashboard solution or on the mobility, so that the information are received for the caregivers at the right time to the right caregivers, so they can perform the patient's care on an immediate note. So with these three pillars in the nursing uh, community, as well as the clinical care team, we try to help those kind of connect so that we try to connect the different system and try to enable via visualization of or audible of information by sending the alerts and notification. So how we are doing, and this is a class, some of the examples which we have done using our platform. One of our flagship hospital is Sengkang General Hospital, where we have try to address all the three pillars in our solution portfolio. Like we connect to the various systems inside the hospital. We do the filtering and prioritization of the information and massage the information so that it can be sent to the right caregiver, so that it will have an actionable insights for before providing the care to the patient via our mobility and the dashboard solution. So whatever our platform, which I just shared with you in my previous slide, we exactly implemented in Sengkang Hospital, and it's up and running from last 2018 onwards. And not to say only on the restructured hospitals we are working, we also work with some of the private entities and small medical centers, and also the elderly care center, which is Alien Nursing Home. We do the intelligent sensing using our sensors-based technology to address day-to-day clinical challenges and the problem statements which the nursing care had. We are trying to address that using our solution. So the last but not least, Woodland Health Campus, we have been awarded to our nurse call system, but we are also working towards integrating some of the solutions by providing some mobility within the nursing home setup as such. So this is the future hospital which we are working. The present hospitals which we have already been in place with Sengkang Hospital and other sites which I have listed here. So how do we work? We continuously engage with our partners, that is to connect the systems. Like it could be a different system, whether it is a medical device or the EMR system, whether it's a RTLS system for asset management or asset tracking or patient tracking, those kind of things. We continuously engage with various vendors and try to do an interoperability program so that we are abreast with their latest and greatest solutions, so that we can integrate, we can connect that, and we can send the relevant information to our own mobility solution, which is Myco 3, which is already part of Sengkang Hospital. So this exercise we do every 6 months. We have a separate interoperability team where we closely work with all these companies and much more companies where the regionally they are very prominent. We also work with those regional companies like, for example, we also work with Caddy Scientific when it comes to Sengkang Hospital. We have done some integration for RTLS system. So not only global companies, we also work with a lot of local companies to address the problem statement which the hospital has when it comes to clinical coordination solution. So from the solution aspect, from the acute care solution, we really work on the real-time clinical coordination solution, which embarks on the basic principle of proactive care platform, which is basically we define in 5 different pillars. One is the on the safety part, and the second one is the collaborative part, and the third segment we also talk about the nurse call system, which is a smart nurse call system, and the fourth one is the alarm management, which is mobilizing the alarms and the alerts to do the proper escalation and alert presentation of alerts and notification to the right caregiver. And the final one is the clinical decision support tool, which we have a platform where the nurses or the doctors can quickly write their own rules on the fly to receive certain alerts when the conditions are met. So which is very intuitive and user defined, so that it will be easy and quick way to set those rules on the fly, so that they can receive those alerts when the conditions are met. So as I said, I will take a little bit deep into the each of the pillars, that is workplace and safety. How do we manage some of the quick use cases to understand better? We try to do using the workplace and staff safety program. We also have some of the use cases like a man down or no movement function. Those kind of alerts we will be sending to the caregiver group. Like for example, in a ward, there is we call it as a personal alarm, where it can be activated by the nurse team, so that it can be sent, the alert can be sent to the group of nurses who are managing that particular ward when there is any immediate impact on the nurse with respect to workplace safety, staff safety. So there could be additional workflows can be used. This is one of the use cases predominantly we are working on this particular product. So, and another solution pillar which we talk about is care coordination, which is more and more we are hearing with the patient-centric approach. We try to bring the team, could be doctors, nurses, portering system, or the respiratory therapist. Based on the event type, the team can be escalated, and the right team can be communicated, and they can be brought into a coercive action kind of role. That means you can securely send a lot of information exchanges between the care coordination team by sending the videos or images or the voice files. Like images when it comes to the skin rashes or something, you want to show it as part of the progressive note for the EMR system. And if you want to have a staff handover, you can do a quick voice file transfer to your next caregiver who is coming and managing these patients. Some videos related to the wound management or something of that sort, we can quickly transfer over the care coordination team to get the quick insights and the inputs of that particular patients whom we are managing. So all this information are securely managed within a same group of users, and between the role shifts also we can manage with the seamless information exchange, so that no need to have that kind of high handover staff handover which we do normally between the shift handover. We can minimize the time required to do the shift handover by doing this kind of using this kind of care coordination tools. And third pillar, which is talking about rapid response team, we just not only work on basic nurse call code blue events, we also connect to the medical devices to get the bradyc or tachycardia alarms, which is critical alarms that can be sent to the right rapid response team. Could be of a cardiac team or a trauma team or a stroke team, based on the kind of alerts we receive from the medical devices or the nurse call buttons or any other means which we want to do, and we can mobilize the rapid response team. Those rapid response team can see exactly which patient, which floor, what information, and they can communicate with the staff nurse at the bedside, so that they can have a quick and easy access of the information while the rapid response team reaching towards the location. So with our smart nurse call system, a platform which is built a very integrated way. So we can integrate it to the EMR system, as I said before, and we can also connect to the RTLS system for the bed exit, or we also can connect to the smart beds to bring in a lot of different alerts from the smart bed, so that we can send it to the EMR system or to the third party event notification systems, or within our platform we can show it on the dashboard as well as to the mobility solution. And all in all, at the overarching feature which we have is timely reporting of this information. Like it can set some threshold values of for measure the KPI for the hospital, which can also be dealt along with when we receive and accepted. The alerts are received and accepted. We can put the KPIs and we can see time and again the KPIs are met as part of the hospital policies. So the final piece of information part is clinical monitoring and alarm management. More and more devices are connected to a patient, whether it is in the inpatient ward or the critical care ward or high dependency unit. And apart from that, now in the step down care, there will be wearable devices. We try to bring in that information into our portfolio, and then we send the information to the relevant caregiver, so that we know exactly what information to be sent, and what are the once the thresholds are met, then only we send it to the right caregiver, so that they will have an actionable insight when they receive those information on the dashboard as well as on the mobility solution. So with the futuristic roadmap, and more hospitals are embracing on the technology of silent ICU, we are, as a Ascom, we are trying to provide a platform of working closely and engaging with the most of the medical device vendors like Philips or Draeger or B-Braun pumps. We are trying to work with them to bring in the silent ICU concept. That means we try to silence the alarm at the bedside, and we take over that alarm on the dashboard and the mobile device, so that remotely the patient can be monitored, and less noise to the patient, so the recovery time is faster, so that the patient can move from ICU to the step down care or into the ward as early as possible. So as part of the HIMSS program last year, we demonstrated the silent ICU working with Epic plus Philips, Draeger and B-Braun and Arcomat pumps. We are working closely with them to drive the silent ICU concept, which we showcased in HIMSS this year. So we also talked about, for the acute care solution, I just discussed how we can enable quick proactive care of decision support based on the conditions or the rules. On the fly, the caregiver can implement that. From the reactive approach to a proactive approach model, which we are within our platform, we try to bring in the information so that the caregivers can write a quick rule engine rules, so that based on the conditions are met, then only the alerts are displayed on the caregiver's mobile or a dashboard. Few examples I can tell about clinical decision support, which we managed to do in as part of our implementation rest of the world. Something related to Aldrich score or PACU or EWS scoring, which exactly integrate to the EMR system, as well as alert to the caregivers when the news or news 2 scores are high for that particular patient. And these support system can be addressed to each of the patient's level. We can go up to the patient level, and we can define different rules engine according to the requirement. So this is very user friendly, creating rules, so that it will be quick and easy and fast to create new rules, so that it will be adapted to each patient conditions we want to see as part of the clinical workflow optimization. So how do we do that? Quick high level, just to give things, some of the use cases which we are doing, like as I said, early warning score, atrial fibrillation, sepsis alerts. These are the things we can quickly generate the rules engine, which is just a UI driven rules engine. No heavy technical manpower is required to drive these rules. which can be enabled onto the dashboard as well as onto the mobility solution. If you see the three pillars which we are talking about, connect and make relevant, that is in the middle portion, and enable to the mobile or a dashboard for the caregivers as the output of the information. So these are the few examples I have given the use cases, but it is up to the imagination for the hospitals how they want to address the workflows and create their own rules so that they can receive the alerts at the right time. So this was the part of our proactive care platform, and of the five pillars we talked about, and the decision support tool, how easily we can configure for different workflows at the patient level. And now the next part of the solution portfolio, which I want to quickly talk about, is centralized dashboard and the mobility, which I discussed in my previous slides, but I'll just give you how we are trying to address by providing the information on the dashboard to reduce the alarm fatigue for the caregivers inside the care setting. So we know that when it comes to intensive care unit, we will have a lot of medical device alarms. We try to properly manage those alarms to send to the right caregiver. And we also do a quick and easy workflow optimization of as and when the nurses enter inside the ICU room, we show the nurse presence so that the alerts will not be distributed onto the mobile device, because nurse is already present inside the ICU room. Some kind of alarm fatigue management workflow solutions which we can adopt as part of the our solution. So, and also we use advanced alarm filtering, which we discussed now, to reduce the non-actionable alert notification. We can stop that alerts receiving onto the mobile or the dashboard so that we can reduce the alarm fatigue. So when it comes to medical devices like a patient monitor or a ventilator, apart from the alert notification or the alarm notification, we also give the contextual awareness by sending the waveform in the near real time for the caregiver before they are heading to the patient's bedside. So while on the move, they can see the actual near real time waveform on the event which they receive as part of the awareness, contextual information awareness for the caregivers. And we also do the alerts redirection, so that if the nurse A is busy with some other patient, we try to escalate to the secondary nurse so that none of the alarms or the alerts are missed when the devices or the nurse call alerts or any other third-party system which we are connected will send those alarms onto our system or on our mobile device. So as I said, this is the solution which we were talking about. So as and when you get an alarm, you will be displayed. If you want to see the details of the alarm, then only you click on the details. One classic example which we talk about is inside the ICU, you have multiple pumps connected to a patient. You exactly want to know which pump is getting end of infusion and what kind of medication is getting end of infusion before reaching to the bedside to manage those alerts. So this will give a comprehensive contextual awareness along with the patient information, which will give more clinical insights for the caregivers so that they do a proactive care for that particular patient when it comes to the management of different alarms and notification. So as I said, we have 4 layers when we do the workflow optimization for managing the alarm fatigue. For example, the first layer is the patient monitor, and then you send the information to the nurse workstation. But predominantly, most of the nurses will be around the ward, rather than most of the time they'll not be spending the nurse workstation, but still we push it to the mobile device for the primary caregiver. If she declines, then it will go escalate to the secondary caregiver so that the alert is monitored and acknowledged at the bedside so that it can be disappeared from the nurse station as well as on the mobile device. So this is a quick UI workflows to show how we do and manage the alarm fatigue as part of the solution. So as I said, whenever we send the alert from the medical device, along with the contextual information, that is a waveform information, along with the alert, will give you more situational awareness for the doctors or the caregivers to respond to that particular event happening at the bedside. So we show it high, medium, and low alarms, and we can also support better prioritization. That means only high will go to the mobile caregivers, and medium and low can be shown on the dashboard along with the high alarms. All these permutation and combinations of how we want to show and display the notification and alarms can be done in our middleware, so that it can be addressed at the right time to the caregiver. So this will enhance, minimize the work interruption as part of our solution portfolio. And finally, the last component which I want to discuss today is about the sensors. During the problem statement workshop, a few of the caregivers and the nurses were talking about some of the problem statement which they want to manage when the patient is in the toilet. This is one of the classic solution example which will embark on this particular journey, which we have done some implementation in locally as well as erstwhile in Nordic countries. I will take you through some of the solution portfolio, what we are doing, and what we can achieve with the intelligent sensing and with the IoT sensor or the wearable technologies. So as you see in the pictorial representation, in a room, you can connect the sensors wherever it is required based on your workflow requirement. So here, if you see in the pictorial representation, we have put the sensors inside the toilet. Outside the toilet, we have put the sensor below the bed to do some kind of bed exit workflow. And outside, on the door, we have put some sensors so that when the patient or the resident is out of the room, we manage to send the information to the right caregiver. So whatever the workflow demands, we work on the type of sensors we need to use. There are Ascom manufactured sensors, as well as being a device agnostic platform. We also work with third-party IoT sensors to bring in the workflow, which is for workflow desired from the hospitals or the community care to drive the problem statement and bring the solution to the front. So this is one example which how we do that along with the sensors technology. And with that sensors, based on the sensor events, we can try to mobilize the information, like what activity is happening. Like for example, if the patient is inside the toilet, that means the sensor activates and that information can be sent to the caregiver or on the dashboard or something like that. So, but it's not that we want to send every time. We can restrict, like you can define what kind of movement you want to manage the information with the sensor, so that it can be displayed to the caregiver, so that they will be receiving only those information when the workflow demands. We can, as I said, we can mention, we can add the resident profile, or we call it as patient profile, so that we know exactly what kind of patient they are, like whether it's an elderly patient or a dementia patient, so that we know exactly what kind of alerts we'll be receiving from that particular patient bed or on the resident as such. So if you see here, there are different alerts we can enable or disable, so that it is according to the bed, according to the resident room or the location we can configure, so that we can set those triggers to be received on the dashboard or the mobile device. So as I said, we can, once we do the particular configuration, when the statuses are triggered, it will give you a complete information along with the patient information and what is the context of the alerts received on the mobile device or a dashboard. So we will have a quick dashboard solution, which will have some kind of data analysis to understand more better on each of the residents or the patients or the elderly care patients in the community care, so that they can understand clearly uh, what's happening for this patient at this time of this hour, so that they can manage proactively those particular patient. So why I am showing this solution here is because we had a problem statement which is related to toilet alerts. So where we can work on this kind of technology to bring in a very quick and easy way to implement solution with a small sensor inside the toilet, and we monitor that in the dashboard or the mobile, so that we can get the right alerts when the caregiver is outside the toilet while the patient is inside. Something which we can think of to drive this kind of solution as part of our partnership within the restructured hospitals here. So this is one of the case study which I want to talk about, just to give you the power of managing the alarm fatigue within the hospital. This is one case study done with our client, where we had our nurse call solution, and we have connected to various systems inside the hospital. But when we try to approach this hospital to drive the alarm management or alarm innovation solution, before that, we did a study just to monitor patient alarms. When we started the study, before implementing our solution, uh, we saw that there were each monitor at the end of the day was generating up to 7,412 alarms. That is before deploying our Ascom solution. Once working closely with the caregivers and the project sponsors to understand clinical team, what kind of alarms can be grouped, what kind of alarms can be delayed, what kind of alarms can be filtered to stop it. We understood clearly, and with the caregivers and the project team, the clinical team, and then we defined this particular solution and configured according to the clinical requirement. We saw a reduction of 58% the messages specifically from the patient monitor, that is medical device across the hospital. That is around up to 3114 alarms after filtering this particular alarms by different fashion, like that is by group or delay or stop. So all in all, we saw a 58% reduction, which definitely had a positive impact on the clinicians and the nurse as a whole. Like the point number one was a fewer distraction, less work interruption, and of course reduced alarm fatigue. So uh, before I can take on the question, uh, I just wanted to tell why Ascom. What is that we are trying to bring in within our portfolio of products and the solutions which we have, so that it can help the hospitals in Singapore to drive the new solution and the innovative solution for the hospitals. As you saw, we have an end-to-end solution, and we are being a vendor neutral solution, so that we can connect to any of the hospital systems, as I discussed previously. And we can start with small and grow bigger, as there is no uh, uh, thing as a big bang solution or something. We can start with small for one workflow, implement that, and we see how it will give the value, and then we can spread across uh, different segments, like whether it is an inpatient or a critical care or the step down care or wherever we need. And we saw something, we do a quick and easy way to manage the alarm fatigue, being coming with a silent ICU concept, and having a overarching R&D working on that particular piece. We are really being a platform which really uh, uh, hear and listen to the caregivers in addressing the alarm fatigue as part of the solution. And as I said, we don't stop on the medical devices or the systems. And today's world is about wearables and IoT sensors. We have a platform which can work as part of the wearables and IoT sensors integration. And top of it, we have our own mobility solution, which will help you to address the mission critical communication, being, as I said, for the clinical care coordination or any other task management of particular task for the particular activity can be addressed using our mobility solution. All in all, we have a compelling story for the hospitals by and large. Within one solution, we can bring a lot more workflows and innovative workflows to help the hospitals by and large in Singapore. This is my last slide. Uh, yeah, maybe I can take some questions if there are some. I'm happy to answer those questions.
Yes, thank you, Vic. So yeah, we're open for Q&A. We don't have much time, so anybody want to ask question can unmute yourself. If not, you can also type in the chat box. Yeah.
Yeah, let me.
There's quite a lot of information. I believe there should be many questions.
Yeah, true. And definitely we can be reached out. Nikar will help us to, if in case anybody have questions, they can come back to us at the later stage. We are happy to answer those questions on how we achieve some of the solution which they are looking as part of their problem statement. We can work closely with the hospital team.
I wonder if we have any Sengkang nurses here. Doesn't seem to have. So maybe, okay, a question for me. Since you have worked on the Sengkang and also the Glen Eagles project as well, so what is the challenges that you face working with those two hospitals?
Yeah, so definitely from the initial stage to understand the pain points of the hospital team, the nursing team, to start with the right portfolio of solution which we can use it. But when we started this particular Sengkang hospital, we were part of the nurse call solution, and then we had to go in for a workflow workshop to understand the pain points, and then to drive a solution after the kind of solution which we deployed as part of Sengkang Ascom healthcare platform. But initially, when we started, the challenge we had was there were certain MSI use cases which we are addressing to address their problem statement. Those problem statements were no more. When we started discussing with the nursing team, the initial use cases which they were trying to have the solution was not part of their requirement as such. When we did the workshop, we saw a lot of new challenges they were facing, especially on medical device alarm management or integration to EMR system to bring in the stat order notification. That means to receive the alert as and when there is a stat order inside the inpatient care. So these kind of new workflow challenges which we were able to uh, uh, see and visualize from the nursing team while we are having a discussion when we are working for the MSI integration. So that was an eye opener for us, and that gave us a lot of opportunity to work closely with the nursing community to bring in a lot of different workflows to address their current challenges apart from what was there as part of the tender MSI use cases. So a lot of new workflow solution which we implemented when we start discussing very initially during the workflow workshops.
So you mentioned quite couple of times about the challenges of workflow. So in this case, when, as you know, nurses' workflow are quite dynamic and it change quite frequently based on the needs. So in this case, like Sengkang case, was it the IT team who managed the workflow, or are the nurses the one that actually managed the changes in workflow? And how can the nurses cope with all these changes?
Yeah, our connection point was nursing informatics team. So the problem statements were coming from nursing informatics team. We were providing the solution, and then we used to take it from there to how we can implement that solution as part of their day-to-day activity. So our communication point is always the hospital nursing informatics team. So that's where our starting point. Is that answer your question, Nicker?
Yes, yes.
Yeah.
Can you talk a bit about the Woodlands project? In this case, it's future, right? So how different it is from the Sengkang project?
Yeah. From the Woodlands, it's very initial. We are just started our nurse call cabling part of it. We are just in the very early state. We are discussing a few of the workflows, how to manage on the code blue aspect, code blue management, which is we are trying to integrate with their Cisco solution to drive the alarms, so that for the rapid response team. That's one solution we are working closely, which is very early part, because even the implementation has not started for the nurse call. So other workflows we have not started discussing yet, but the immediate workflow which we discussed and we are trying to work is on the code blue management. That's working to send the information to the Cisco mobile device, so that rapid response team will be handling that information about the location, and as well as the event information, so that they can communicate with the nurses at the ground. Yeah, this is one workflow we started as part of the Woodlands project.
So in this case, the Woodlands one is actually a nurse call system rather than the communicator, right? So
yeah, so as of now, it stands, we are just a nurse call system with the few components of connectivity. And Woodlands nursing home, they are looking for some kind of mobility solution. It's very early stage, but they're looking some kind of mobility solution for managing the nurse call alarms, purely nurse call alarms. Not we even discussing other kind of workflows yet, but it's very early stage now. Yeah, these two additional workflow solutions which was being discussed with the Woodlands team, apart from what we are awarded to. Like for example, Woodlands Hospital was pure nurse call, which we have been entered as part of the vendor contract.
Okay. So as we have mentioned, so for those who have questions and probably at a later stage, you can just email to me. This is my email address, or you have any information that you need, just email to me. I can link you with VIT or Business Sweden. And so for tomorrow, that will be the last session for this whole program. 4 p.m. we have OptiView. So we want to thank VIT for today for sharing his solution on Ascom. And thanks everybody for attending. Have a good day. Bye.
Bye. Thank you, Nicker, for providing the time. Yeah, thank you very much. Thank you, everyone.